Let's discuss urinary bladder deficiency code as we continue with diagnosis according to Zanko organ patterns. If there is kidney yang deficiency, the kidneys may not be able to carry out their activities in relation to fluid physiology and the storage and expulsion of urine. Urinary bladder deficiency code is therefore kidney yang deficiency with signs that there is bladder functioning. Now let's look into its etiology. Kidney yang can be weakened by disease as well as food, drinks, and medicine that have a cold dynamic or temperature. Congenital weakness, old age, climatic cold, hard physical work, lifting heavy objects, standing for long periods of time, and too much sex can weaken kidney yang. Symptoms and signs. Frequent or urgent reurination. Copious amounts of pale, clear urine. Nocturia or enuresis. Incontinence, aversion to cold, cold limbs, shiny white facial color. Pale, swollen, wet tongue with white coating and a deep and weak pulse. The key symptoms here are frequent urination, aversion to cold, pale, swollen tongue. Treatment principle, warm kidney yang, assuage the urinary bladder. The acupuncture points you can choose from kidney 3, kidney 7, REN 3, REN 4, REN 6, bladder 23, bladder 28, and DO 4. For the kneading technique, we tonify and moxa is always also recommended. For a further explanation on the choice of points, kidney 3, kidney 7, REN 6, bladder 23, and DO 4 tonify kidney yang. REN 3 and bladder 28 drain dampness from the urinary bladder. The patient should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature, especially in winter. In practice, this means avoiding fruit unless it is boiled or baked, salad, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing foods such as oven-baked and grilled dishes, which are more warming than steamed and cooked dishes. Hot spices such as chili are not necessarily salutary because they will cause the person to sweat and thereby lose heat. Tonifying a deficiency condition is something that takes time and cannot be forced. The use of spices in general is helpful though, as they can activate yang. Spices that warm and tonify kidney yang are cinnamon, cloves, fennel, basil, sage, fenugreek, horseradish, rosemary, and black pepper. Foods that specifically tonify kidney yang are oysters, smoked fish, salmon, tuna, lobster, trout, mussels, shrimp, lamb, venison, duck, roast pork, kidney, chestnut, walnuts, pistachio, black sesame seeds, quinoa, oats, buckwheat, millet, aduki beans, black beans, deep boiled lentils, raspberry, and cherry. Green tea is cooling, so black tea will be better. Otherwise, ginger tea, fennel tea, yogi tea, and jasmine tea will all be good. A person who is kidney yang deficient must ensure that they get enough exercise. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. They must, however, be careful that they do not train so intensely that they become fatigued or tired, because this will further drain their yang. It is a good idea to start the day with physical activities that can activate and circulate qi. Keeping warm is important, especially in the lumbar region and the area below the navel. Wearing a belly warmer or a woolen stomach scarf around the midriff and lumbar can be recommended. Protecting this area from drafts should be a priority. A ginger foot bath is also beneficial, as is drinking ginger tea. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and yang in general. Besides the above advice, men should limit how much sex they have, including masturbation, as kidney yang is expended upon ejaculation. Lifting heavy objects and standing weakens kidney yang and should be avoided as much as possible. Urinary bladder deficiency code can be caused by the following patterns of imbalance: kidney yang deficiency, spleen yang deficiency, spleen qi deficiency, cold, and damp. In turn, this can result to urinary bladder damp cold, urinary bladder damp heat, kidney yang deficiency, spleen yang deficiency, and damp. To summarize, bladder deficient and cold has its etiology in excessive sexual activity, exposure to cold weather conditions, or living in cold and damp places. The underlying or accompanying pathology are kidney qi not firm and kidney yang deficiency. The signs and symptoms: frequent abundant pale urination, dribbling after urination, incontinence, enuresis, lower backache, dizziness, nocturia, lower abdominal pain, and weak stream. The pulse will be deep and weak, the tongue pale and wet. Treatment principle: warm and supplement kidney yang. For the acupuncture treatment, bladder 23 to supplement kidney yang, bladder 28 to supplement the bladder, spleen 6 to supplement the spleen, REN 3 to supplement the bladder, do 4 to supplement kidney and bladder, REN 4 to boost qi and supplement yang, and do 20 to raise yang. We needle with supplementation and add moxa. For severe deficiency cold, we can add REN 6 and REN 4. For kidney yang deficiency, we can add do 4 and kidney 3. Thank you for your attention.